Namaskar. Assalamu alaikum. Good afternoon, Rajkot. Respected Dr. Khurana sir, Dr. Farooq Master sir, Dr. Girish Gupta sir, Dr. Tarkeshwar sir, Dr. Subhash Kaushik sir, Dr. Rajat Chattopadhyay, Dr. Manoj Patel sir, and Kalpit bhai. Very, very happy to be here after a long time. I think last year આવેલો એના પહેલા બી ગુજરાતી ચાલશે? I believe કે 10th April નું celebration હમણાંથી ચાલુ થઈ ગયેલું છે. So it's not World Heart Day, it will be World Heart 2 months, March and April. And I was not made aware કે મને શું બોલવાનું છે. I thought કે નાનું કોલેજનું ફંક્શન હશે તો મેં બોલી લઈશ હોમિયોપેથી ઇન હાર્ટ ફેલિયર. अब दिल है तो दिल तो टूटेगा ही ना. टूट जाए तो चलता है, फेल हो जाए तो बहुत मुश्किल होती है. And COVID has given us enough cases, especially the second wave 2021 ના અંદર એટલા બધા કેસીસ આવેલા કોવિડમાં of heart failure, first time heart failure. The presentation of acute myocardial infarction is normally chest pain, radiating here, this, that, but AMIs, anginas presenting directly with heart failures, particularly જે લોક સુઈ ગયા હોય એના માટે, particularly in diabetics. Unfortunately, India is the world capital of diabetes. અને આપણા यहाँ કયું ડાયાબિટીસ સૌથી વધારે છે? MODY. Maturity onset diabetes of young people having diabetes. And one of the very important features of MODY is when they get heart affected, they land up with heart failure. They don't present with classical symptoms of chest pain, radiating here and there. And તે લોકોમાં heart attacks આવીને ચાલા બી જાય તો ખબર નથી પડતી. Nonetheless, હવે ટાઈમ ઘણો નાનો છે એટલે I have to go and I'm already actually late. So I will be sticking to my point, homeopathy in heart failure. So પહેલા we used to use certain drugs like digitalis and all, fair enough. But then we found out certain drugs like strophanthus, fasciolus, nana drugs. But in heart failure, they work exceptionally well. Now this is a very broad statement. Working very well, so what? In which cases of heart failure, how to give? Is it only mother tinctures or is it potencies? So in homeopathy, we have got different types of prescription. One is so-called constitutional prescription. One is so-called symptomatological prescription. And the third, as Boric has written, is a pathological prescription. Boric na preface માં આપેલું છે. And I'll read. The fact is we need any and every way of finding the right remedy. The simple simile. Pain aggravated by motion. Brian, yeah. Simple simulation. The simple symptomatic simillimum. And the farthest reach of all, the pathological simillimum. And I maintain that we are still well within the lines of homeopathy that is expansive, progressive, science-fostered and science-fostering. So this is another method of studying homeopathy, and we are still in domain of homeopathy. It's a pathological prescription, but pathological prescription માં બી અમને simillimum ગોતવું છે. I congratulate NCH, the work they are doing, CCH, the CCRH, the work they are doing, and हमें બધા हमारा માટે જ છે and we have to contribute. And this is a small, મારી એરિયા તો ઘણી નાની છે, પ્લસ ઇન્સ્ટિટ્યૂટ બી નાનું છે, but still as much as possible we are trying to contribute with homeopathy. I hope all of you can follow suit. As Dr. Tarkeshwar Jain has already said, okay, what is science? Science is what I can do, you also can replicate. So આ એક અમે નાની સ્ટડી કીધેલી અને બે કેસીસ બતલાવીશ. Normally teaching is always done by failures, but unfortunately in an audience like this, फेलियर्स बतलाओ मैंने ठीक ना पढ़ू तो मैं सक्सेसेस बतलावीश ओके नेक्स्ट प्लीज पीछे कैसा है फर्स्ट करो okay what is heart failure when the heart is unable to function its own function perform na kari sake that's heart failure that is abnormality of cardiac function responsible for failure of the heart to pump blood at the rate which does not meet the metabolic demands હવે એના ઘણા physiological adaptations છે I'm not going to go in depth the types in modern medicine ये लोगों ने જોઈએ right side heart failure है तो दवा अलग लेफ्ट साइड है तो दवा अलग एक्यूट है तो अलग क्रॉनिक है तो दवा अलग लो आउटपुट है अलग सिस्टोलिक है तो अलग डायस्टोलिक हमको होम्योपैथी में आई फाउंड दिस वेरी नॉट यूजफुल सो वी हैव मेड आवर ओन द पेशेंट प्रेजेंट्स टू अस इन विच टाइप ऑफ फेलियर नंबर वन इज आइदर इट इज इडीमा प्रिडोमिनेंट मेन सिम्टम इज इडीमा तो પછી then a focus goes on some other sets of drugs second would be breathlessness predominant सांस બહુ ભરીને આવે છે થાકી બહુ જાઉં છું જલ્દી से સોજા છે પણ એટલા નથી and the last is both so certain group of pathological drugs act in these group of disorders that we have seen હવે there are many causes right from COVID and its vaccination to myocardial infarction, IV fluids, drugs, infections, so on and so forth. Basically, अगर आप susceptible हो, तो heart failure होगा, and the base is generally diabetes. There are major criteria. First is nocturnal dyspnea. राते 10-11 वागे सुई गया, 1 वागे उठसे air hunger जोइसे. Not for some other reason, only for heart. ये तो बोलेंगे कि JVP raised. If you put a stethoscope, you will find bubbling sounds, rails. Cardiomegaly, acute pulmonary edema, S3 gallop. Lup, dup is normal. But this is a sure sign of heart failure. It's a bad case. If you find this on a stethoscope, please hospitalize the patient ASAP. Then we have got minor criteria like ankle edema. सब यहाँ थी જામનગર રોજ જાઉં છું મેં મારું કામ છે અઠવાડિયામાં જવું પડે છે બસમાં બેસવું પડે છે કારમાં જવું પડે છે 3-4 મહિનાથી મને પગમાં સોજા આવે છે પહેલા નહોતા આવતા આંખને નીચે સોજા આવે છે ઊંઘ નથી થઈ અરે નહીં ઊંઘ નથી શું થઈ why is the person who has been going to Jamnagar for work for example from Rajkot I am going for 20 years અને 3-4 મહિનાથી જ મને સોજા આવે છે anywhere swelling on the body is a bad sign and you start picking up swelling below the lids, swelling on the feet. Although transient, you can pick up heart failures very soon. You should investigate this, or at least the kidney, but pehla to heart. Nocturnal cough. સવારમાં ખાસો બપોરમાં ખાસો ઠીક છે nocturnal cough as soon as hyoscyamus spongia drosera not drosera like a cough hyoscyamus and spongia typical dry cough and the cough comes from here and not from here. Dyspnea on exertion. And it's not dyspnea on exertion, basically it's fatigue. पहले 2 किलोमीटर आराम से चल जाता था, अब सब आधे किलोमीटर में सांस भर जाती मैं चलता हूं, लेकिन सांस भर जाता हूं. पहले 4 मंजिले चल लेता था, अभी 1 मंजिले में मेरे को रुकना पड़ता है, फिर चढ़ता हूं. ये धीरे होता है, and these are actually the heart is telling you कि बस कर, I am failing. Pleural effusion, etc., decreased vital capacity, so on and so forth. बच्चाओं में મને લાગુ કે ડોક્ટર્સ ને ખાલી સ્ટેથોસ્કોપ ઇઝ ઓનલી ધ જ્વેલરી, હવે આ બધું બી આવી ગયું છે. ફીડિંગ ડિફિકલ્ટી, બચ્ચું दूध पीने immediately छोड़ी नाखे breast or the nipple. That's a very very important sign. Why is the child not drinking continuously? Second is a cry. If the baby is crying well, heart is safe. जो एनो cry whimper में बदली गयो से, please think of it can be because of heart. The cry leads you to heart diseases or heart failures very very soon. Now, let's go to direct management. As a homeopath, તમે શું કરી શકો? આપણે બધા improve કરી શકીએ quality of life. Yes, that's what we are meant to do as doctors. Remove the underlying cause. Yes. Remove the precipitating cause. Ailments from, whether emotional है तो emotional, physical है तो physical. If the patient is not able to do, then talk to the friends, talk to the family, talk to even their colleagues and partners, but somehow try to remove. So here we are not only homeopaths, we become health coach. And it's a very, very basic thing of management of heart failure. It is not drugs. Drugs to ghani dur nahi baat hai. This becomes very, very important. So removal of precipitating cause. Unless you do that, ऐसा नहीं हो सकता कि मेरे को अल्सर है, आप मिर्ची डाल रहे और मेरे को जलन हो रही तो आर्सेनिक दो. अरे जलन पर मिर्ची डालना बंद करना. That precipitating cause has to be removed. And here it is, aphorism number 8, causa occasionalis. Unless you remove it, you do not get the totality of symptoms. Low sodium diet, particularly low sodium diet, avoid IV fluids. अगर anemia है, so anemia के अंदर it's better to give drugs rather than IV. You can't give fluid. Mechanical removal of fluid, dialysis is necessary if in certain cases. And we are physicians. We are not homeopaths, allopathics. तो अगर जरूरत पड़े, heart failure patient ने अगर pacemaker लगा हुआ है, yes, make it. Now let's come to the study. Difficulties for homeopathic and allopathic ICUs. Many times we don't have own ICU. तो तुमने बोला है कि भाई बहन चलो हमारा भाई एडमिट है हार्ट फेल है તમે કઈ કરી શકશો કે નહીં. So here the expectation of a homeopath in an allopathic ICU is very very big, but the time is less. Settings are very artificial. You will never get the sweating of opium or for that matter any other symptoms which are basically physician's observation, because in ICU the setting is always artificial. Then there are few or no natural symptoms to prescribe upon. The patient is already on many allopathic drugs, and homeopathic help is resorted when pathology is advanced and allopathy has failed to act, and yet we have to give them evidence-based homeopathy and results. So in this context, we did a study in 2021, PADS the Fantastic Four, a comparative study of digitalis, which is a well-proved drug, and in a milestone rakhine, in a standard rakhine, bija 3 drug, Strophanthis, Adoniswar, and Fasciolus nana, we did. But then, after doing this, we were so successful in the study, we did not stop here, and pachi kai sagal, ki haji we extended the study to many other drugs, which we are still doing. So 3/4/2021 to 25/5/2023, we wanted to know कि these so-called small drugs, heart failure, कौन से heart failure में use होते हैं, and उसको कैसे कैसे देना चाहिए. 100 cases, उसमें 8 animals and 5 canines, because I have lots of animals also consulting me for heart failures and heart diseases, who received any of the 4 drugs. अरे भाई, શું છે? So 100 cases, 8 animals and 5 canines who received any of the 4 drugs, digitalis, Strophanthus, Adonis, were selected with a defined inclusion-exclusion criteria. The venues of the study were at Nagpur. Obviously, detailed case taking, standardized buddu kari nakho. We give the selected remedy, indicated remedy. But जो indicated remedy ना काम की थी, तो बची आज 4 माह से कोई drug हमें start की दो. Now, whenever we start with any therapy for heart failure, front charge is which is number one is, as I said, counseling, not only of the patient but all the relatives. Second is the diet. In our center, we use blood group diet, which we are very, very successful. And third is exercise. What people don't realize is, so heart failure का exercise कैसे करेंगे? अरे कह रहे हैं क्या? Exercise नहीं करेंगे unless you develop your muscles, these muscles, skeletal muscles. घर में बहुत problem था. So what we are today actually facing, જોવામાં Indians are lean obese. अपनो blood જે છે વધારે પડતો thick છે. That's why Indian cardiologists prescribe 2 allopathic drugs for blood thinning. One is aspirin, the second is clopidogrel. Either one drug is enough in throughout the world. एक clopidogrel दो या aspirin दो, दो क्या को देने का है? Because Indians ma, our blood is a little bit more thicker. That is genetic this. तो જોવામાં દુબલા પતલા, હાથ ને પગ તો ઘણા કામ છે, only પેટ નીકળેલું છે. That is called lean obese. What we lack is, particularly in chronic kidney failures, chronic heart failures, and chronic diseases, is loss of muscle mass. Until you don't develop a good muscle mass with specific exercises, you can't have lots of successes in this area. So, and that has to be done by a trained person. જે જીમમાં છે, પણ જીમમાં એક્સરસાઇઝ નહીં, પણ જીમનો ટ્રેનર તમને આવીને કરાવે. So, observations. Birth to 87 years of age, males greater than females. 87% continued a full study, 11% left and 2% died. Number of patients receiving each drug, 38% received digitalis, 39 strophanthus, 14% adonis, and 9% fasciolus nana. Heart failure cause 19% congenital, uncontrolled diabetes 17%. Baki badha bhi chhe. I'll not go into depth. Effects of drugs. This is most important. 5% વધારે 30% સપોઝ ઇજેક્શન ફ્રેક્શન પમ્પિંગ કેપેસિટી હતી 3 મહિના પછી કે 6 મહિના પછી 5% से कितना लोगों में વધા तो we have got 36% में digitalis, 19% adolescents, but 42% and 42% people coming to me after 3 to 6 months they had a 5% increase in pumping capacity. It's a very, very big number. જે બિચારા લાસિક્સ પર અને ફ્યુરોસેમાઇડ ને બધી જિંદગી પર રહ્યા કરે ડાયટોર પર they keep on getting weaker and weaker. We can only help with either of these drugs, and I'll show you with the 2 cases. Effects of drugs improvement, 6-minute walk test. Forget about echocardiogram. Every time you don't need to do an echocardiogram. 6-minute walk test in your clinic amply proves કે તમારો ડ્રગ તમે કામ કીધેલો જ કે નથી કીધો. If my heart failure patient who has come to me could not walk for 3 minutes or 2 minutes, now can walk 5 minutes, I have made progress. So, again, strophanthus, 39%, 6 improvement. Effects of drugs improving NT-proBNP. NT-proB is a blood test. Whenever the heart fails, it cries. उसके जो आंसू है, वो है NT-proBNP. NT-proBNP rises in heart failure and myocarditis. And if you can decrease NT-proBNP, if you have got drugs to decrease NT-proB, it's actually a remarkable thing. Because घनी बार तो ejection fraction can increase, but NT-proBNP remains the same. And yet again, strophanthus in 41% of cases could actually decrease NT-proBNP significantly. Then acute heart failure के अंदर 63% cases strophanthus and chronic के अंदर 44% digitalis. So digitalis is a very good maintenance drugs for heart failure. Whereas acute के अंदर MI हुआ, heart failure हो गया, अभी आपको बुलाया, डॉक्टर साहब कुछ दवा दीजिए ना, you should first prefer strophanthus. Left ventricular failure के अंदर 43% strophanthus, right ventricle के अंदर digitalis and fasciolus nana, they act on the right ventricular failure. So you have got patients of COPD, ILD, interstitial lung disease, they come with right heart failure. वहाँ strophanthus and adonis पर काम नहीं करने वाला. उसी तरह से बेचारा Adonisfor तो रह ही गया है. Adonisfor is only meant for heart failure with valvular heart diseases, whether it is mitral stenosis, aortic stenosis, regurgitations, both pulmonary stenosis and pulmonary regurgitation. Then we have got heart failure with bradyarrhythmias. जहाँ pacemaker लगाने को बोल रहा है, congenital heart block हो गया, अरे complete heart block हो गया है, immediately pacemaker लगाओ. नहीं लगाना है भाई, हमारी बॉडी हमको नहीं करना है. डॉक्टर साहब आपके पास दवा है क्या? Patient has the right to decide, ना? Not necessary कि लगा नहीं है. So we have digitalis here giving, and with tachyarrhythmias, again here you have to put a pacemaker. We have strophanthus and fasciolus nana. So this was a small study which we carried out for ourselves to understand our drugs so that we can give them in a better scientific manner. So homeopathy, you can different forms of learning of homeopathy. One is seeing the man and the disease separately. The other aspect, the extreme other aspect is this, where you're only seeing the disease. In fact, not only the disease symptomatology, but the parameters. But still we again. So conclusions are, digital is the cornerstone of management of chronic congestive cardiac failure, atrial fibrillation and bradyarrhythmia, especially type 1 degree, for type 1 second degree and AV block. Strophanthus, acute left ventricular failure, tachyarrhythmias, Adonis for left ventricular failure in valvular heart disease. It lowers the NT-proBNP very, very effectively. And fasciolus is atrial fibrillation failure. Atrial failure, not ventricle failure. We are talking about atrial failure. That also occurs. So atrial failure, right ventricular failure, and tachyarrhythmias. Ladies and gentlemen, इतनी बड़ी अपना वैसे है. हमें आना थी हमने पेट ना भरा हो कि भाई ये 3 रेमेडी दी है और भी तो देखेंगे ना. डिजिटाइज अप्रूव्ड है. So we went on to study. We are still studying, in fact. अभी publish नहीं किया, but Laurocerisis, cactus, squilla, grindalia, pulmonary hypertension में. The worst disease for any cardiologist tell me, अरे ब्लॉकेज हो तो मैं एंजियोप्लास्टी कर सकूं, बाईपास कर सके. Congenital heart disease, so you can repair. ASD, VSD, etc. can repair. But what do you do with PPH, this pulmonary hypertension? It's a worst disease. And it occurs in young people. 23-24 बरस से छोकरा छोकरी ने सब सांस फूलने लग गए. क्यों हुआ? प्राइमरी है, पता नहीं. Etiology. Then keep on searching for ailment from. अरे then what is the treatment? Heart lung transplant. बोलना बहुत easy, heart lung transplant. ये किडनी ट्रांसप्लांट नहीं होता तो heart lung transplant लाएंगे कहाँ से? और ला के कर भी दिया तो टिकेगा क्या? It should stay in the body, that rejection नहीं होना चाहिए. And drugs like Grindalia and Aspergillus, they have actually made the life easier. And I'll tell you, I'll give you cases where you have avoided heart transplant. I think this is tremendously beneficial. Strontium carb है, Liatrius spicata. हाँ एक लाइन आप लीजिए. अब उसकी क्या ओलिग्यूरिया है ना सर का? But what? Just giving the land, it is just included in the Vatra Medica. But the clinical things are not giving. We're trying to find out some symptomatology, something to guide us to give this Liatrius spicata drug on a routine basis. Crataegus. And you must have seen Crataegus में last leader उसे. तो पहला कोई भी हार्ट होम्योपैथी पूछो. हार्ट के लिए क्या पहला ड्रग Crataegus है. अरे Crataegus तो लास्ट है. When you start studying, you will realize, at least I have realized, कि Crataegus का जितना ये किया है हवा उतना वो है नहीं काम करने वाला. Hemotoxylon, lithium carb, etc. Prolonged QT. There are some rare disorders जहाँ treatment है ही नहीं. And if we can help in not 1, 2, 3 cases but multiple cases. Now, हमना तो if you come out of BHMS, you are supposed to read an ECG. And if with the ECG reading is not important, if with ECG reading you can give them a homeopathic drug for angina or for that matter this is a small prolonged QT syndrome, etc. तो क्या बुरा है? So I believe, ladies and gentlemen, that is our small work which we are doing, and with a small thing, with 2 small cases, I'll end my course. First case, video. Amna. So, this is a testimony. Both are testimonials. Of course, every patient does not give you testimony. But it is so heartening to see एक नानी बच्ची 18 महीनानी माँ पास आवेली 18 months old, and I have still not seen the child. She is a foreign land. I had to convince only the doctor कि we have failed everything. Just try homeopathy. Australian के केस है. वो कब का था? उसको 6 महीने दिया था. Heart trunk transplant बोलना था. And now she's perfectly well with the ejection fraction of 60%. I would like हाँ सोहम नहीं आमना बोल
about my daughter after what I posted in the first video. Just a little recap about her in case you haven't seen the earlier video. So my daughter was 20 months old and she was really sick. When we went to the ER, we found out that she had some serious cardiac problems. She was in the ventilator for a couple of weeks and then the ECMO machine and back to the ventilator. So overall, she spent a month at the ICU. We were completely at loss. But because I do use homeopathy here in Australia, I contacted my homeopath and asked her, like, is there anything that can be done? She told me about Dr. Aadil, how he's a cardiologist and a homeopath, so I immediately contacted him and we started the treatment. Few weeks later, when my daughter was discharged, we asked them, is there going to be improvement with her heart? And the doctors were like, it's very rare, it's going to take years and years, and she's probably going to be on medications all her life. This was their response, and she was on, like, I think 4 or 5 medications when she was discharged. A month later, there was great improvement with her heart. Her ejection fraction at the hospital was, I think, 4 or 5% or 14%. I can't remember, but it was like next to nothing. And then a year later, it improved significantly. And her medication also reduced. Yeah, they stopped one of her medication and they reduced the other. And again, we continued with the homeopathic treatment. And then 6 months ago, which is when I really wanted to post this video, her heart function was completely normal. Actually, it was more than 6 months ago. Like, yeah, so her heart function, they were like, the ejection fraction was like in the normal range, and like it was the most unbelievable thing that happened when the doctor told us. And he wasn't sure if we should continue with the medication or no, and he was also seeing the
video heart lung transplant gone 60%, 14% to 60% Aadil only by one. Initially when she was hospitalized, I had given her an Antimtat. She came out of that ventilator and that ECMO machine and she was discharged. And she was on what was ABCD allopathic drugs, which I could not stop. It was not under my power. But gradually, the drug showed immediate results, and they only had to stop this. So this is just one case. Aim karine itla bada cases hase. I believe I will give you a second example. Soham. Right. Second. Soham. Antimdametic follow-up drug is Strophanthus.
आज है मार्च 2024
7/9/2021 को मेरे को रात में खांसी आई थी, मतलब 10-11 बजे रात में स्टार्ट हुई थी खांसी और 4 बजे तक के खांसी कंटिन्यू। उन्होंने चेकअप किया, उन्होंने बोला कि हार्ट फेल है, चेस्ट पेन था और हर वक्त लगता ऐसे हाथ पकड़ के रखता,
बैठे भी रहे तो हाथ पकड़ के रखना पड़ता। 2022 के अंदर पंपिंग कैपेसिटी वाज ओनली 15 एंड इनको बोला गया था हार्ट ट्रांसप्लांट।
वो हार्ट ट्रांसप्लांट किए बिगर ये जिंदा नहीं रह सकता। यूट्यूब के ऊपर हमारा हॉस्पिटल का पता निकाले कि चलो हम इधर ऑल इंडिया लेवल तो घूमे हैं, लेकिन यहाँ का भी ट्रीटमेंट करना
अभी तो पूरा ठीक है, मतलब
कोई भी चेस्ट पेन नहीं है।
2-4 किलोमीटर 4 फ्लोर तक के आराम से
33% उनका पंपिंग कैपेसिटी बढ़ गया है। हार्ट ट्रांसप्लांट जैसे कुछ करना चाहिए?
नहीं, तो सोच भी नहीं।
हमारे पास आए थे 18/9/2023 और आज है मार्च 2024।
Young boy, 27 years old male, heart failure. और रीजन पूछ के थक गया कि क्या हुआ था, इमोशनल सेटबैक मिला था, कुछ नहीं साहब, बस सांस फूली थी, कोविड हुआ था, वो भी नहीं हुआ था। 2023 के अंदर ये बंदा आता है विद दिस ब्लीक सब ट्रांसप्लांट करना। आप रोक सकते क्या कुछ महीनों के लिए? ये था 23 और 26 के अंदर भी शादी करने वाला है। He was preparing for that क्या एंट्रेंस एग्जाम, ऐसे बंद करते रहे एंट्रेंस एग्जामिनेशन एंड काम पे लग, एंड नाउ वो खेती बनाता है। कहाँ गई वो हार्ट फेलियर? 14% खेती। He can actually does farming. He does not supervise the farm. He does farming. If we can with homeopathy give such results in most of the cases, not all, even if it is association with some other drugs, like it is impossible for everyone to stop all the allopathic or Ayurvedic drugs at some point of time, but gradually come kare na kiya and give such results. I believe homeopathy has done its job. Thank you very much. This is called Dil Ki Seva, Aadil sir. Thank you very much.
Wonderful, isn't it? Just unimaginative. Can heart transplant be avoided with homeopathic medicine? This is a very serious question in the scientific world. And what is Aadil sir's formal qualification, sir? Education?
हाँ?
आपका एजुकेशन क्या है सर?
मैं MBBS किया, उसके बाद DNB मेडिसिन, BHMS, MD एंड PhD होमोपैथी.
MBBS किया, DNB मेडिसिन किया, फिर BHMS किया और फिर MD होम्योपैथी किया. Aren't you fortunate enough to get directly entry into the BHMS? Isn't it? And this is the value of homeopathy, and any practitioner is taking it, taking a pain. See, this is like a diamond. Whether you are using it as a paperweight to hold your degree and to call yourself as a doctor, or you want to join it in your necklace or a pendant or something to show off that this is what you are having it. So that is homeopathy. See, unless and until we see such marvelous results and the cases, and such stalwarts are taking these cases, and there are 3 more cases are there, 3 more teachers are there, and we wish everybody say, and this can be done by anyone. Huh? It's not like Dr. Aadil can only do the thing. And he has almost shown the shortest possible ways, right? ये तो स्पेसिफिक बोल दिया, लेकिन उसके पहले की मेहनत ये है, क्लिनिकल डायग्नोसिस तीखा है या उसके पीछे आइडेंटिफिकेशन होगा. हम लोग क्लिनिकल डायग्नोसिस में भी कितना वीक है. आर वी सीरियस इनफ टू टेक द केसेस ऑफ कार्डियक इमरजेंसी? अरे रिफर करना भी मालूम नहीं होगा और रास्ते में कुछ हो गया ना, प्रॉब्लम्स. So that's a very seriousness on part of students that takes it.